I'm an adult hepatology research fellow, and today I'm going to talk to you about something called MDR3 deficiency. Now, MDR3 is a transporter protein in the liver, and it is vital for ensuring that the liver and the bile ducts are maintained. Now, if there is abnormalities in the gene that encodes this protein called the ABCB4 gene, it was found that there was an early onset of liver disease that affected children. What we are looking at and we have found is that there are now adults who may have abnormalities in this gene and this protein function that have different types of liver disease. Now, what is clear is that children with cholestatic liver disease are routinely tested for MDR3 deficiency. However, adults, we don't know who should be tested, and also how should patients that are tested be treated, and should they have any different treatment. This is relevant for relatives and parents of children with MDR3 deficiency, because it is likely that they may have one abnormal gene, and it is important for them to understand their future risk of developing liver problems, and the same for siblings of the affected children. It's also important for patients with different types of liver disease to know whether they have an underlying genetic cause, and although at the moment we don't know how they should be treated, or people should be treated differently, it is important for people to understand why they may have developed this disorder. So we are not at the stage yet where we know who to test and what to do with the test, but we are working on that. And it seems like certain groups of liver disease are more associated with these genetic abnormalities in MDR3. One of them is the early onset of gallstones, which even after you remove your gallbladder, symptoms come back. Another is when you have cholestasis of pregnancy, and one of the risks of that is it can recur in future pregnancies. And another manifestation is of chronic liver disease that affects young adults. I'm talking to you today just to highlight this condition. It's something that patients should be aware of, and also clinicians and researchers are increasingly becoming aware of. In the future, we know that routinely people will be offered genetic testing for their whole genome, and we need to know what to do with these results.